Welcome to the CEO Roundtable panel, and we have compiled the top CEOs around the world of colorectal cancer organizations that have decades and decades of experience in building programs, running organizations, and truly moving the needle in bringing colorectal cancer to the mainstream. And they are going to tell you a little bit about themselves and their organizations, and then we're going to chat about, why they got involved in colorectal cancer and some of the great things that they've done, some of the things that they've learned, and share with you some of their own best practices of experiences of what they've learned to do, what they've learned not to do, and so on. What I want to know first off, and what the audience probably wants to know, is what got you into this?
Thank you, Andy. I appreciate it. So there's a hint of it behind me. I was actually a professional musician by training, performing all around the world. I was a trumpet player. I was living in Miami Beach, Florida at the time, performing with the New World Symphony. And I got a call from my parents and saying, Michael, we have a bump in the road. And first of all, I'm like, why are they both calling me? This is very odd that both of my parents are calling me. And my mom says, they found a tumor in my colon. The first thing I was thinking is, where the heck is my colon? I'm like 29 years old. And it's like, okay. And then the second thing I said is, are you worried? And they both started crying. So I knew it was like not a good thing. Fast forward, my mom died on Mother's Day in 2009, and we started a family foundation called the Christopher Life Colon Cancer Foundation, which grew to be the second largest in this space. And then we, in 2016, merged with the Colon Cancer Alliance, and in 2017 became the Colorectal Cancer Alliance. And we focus in three main things. So we call it screen, care, and cure. So we're doing national programs around screening. We're about to launch in March a new campaign with an A-list celebrity with maximum effort, et cetera, to spread the word, which we're really, really excited. It'll be kind of like a what do you call it, Movember type new brand. So really excited about that. We're starting to get into lots of communities on the ground and actually help with screening locally, which is something that I'm really, really proud of. And then, you, Andy, this well, the patient family support program is just, very, very robust and has been longstanding and helps patients from all across the country. And then we also have a cure program as well to fund research. So that's the story in a nutshell.
I'm going to stick with you for a second because you mentioned celebrity. How have you been able to engage them? And do you feel that they've really helped bring attention and helped sort of move the disease forward?
Yeah, I think we've engaged with them on multiple fronts, awareness raising, publicity, media, storytelling, financial support, et cetera. But, I think that if you look at the colon cancer space compared to others, pancreatic cancer, for example, or breast cancer, as we all know, or even lung cancer, we don't hear about that many people, right, being diagnosed and or dying of the disease, even though we know that they are. So I think, and it is still a huge untapped territory. Like we have no organization, should I say. I mean, Katie Couric, yeah, you could say maybe stand-up or entertainment industry foundation, but no large national organization has really done a campaign that has like gotten into the culture of our country, right? Except for Katie Couric's colonoscopy. So I'm hopeful that we'll be able to do that. It's not just the celebrity that's going to make it successful. It's the way that it's done, et cetera.
Great. Barry, colon cancer could not be more personal for you. So why don't you tell us a little about your story, why you got involved with colorectal cancer?
Thank you, Andrew. It's really a privilege to be here with all you. Really, this is not a business I wanted to get into, so to speak. In 1995, I was diagnosed with metastatic colon cancer at a time when there was nothing on the market. And really, there was just 5-FU, one drug, and a pat on the shoulder, get your affairs in order. So it was a pretty scary time with a young family here in Montreal. And trying to actually access care at that time was very much like today. There was really very strong delays in obtaining surgery and no treatments available. And of course, they were treating urgent care. So after having been delayed in the hospital 3 times, getting out of my delays, I went to some friends in New York and actually was being operated a few days later and did some novel treatments at that time. The associations were beginning to gel, and some of the personalities that started Colorectal Cancer Alliance, our association, and others around the world, the advocates were being born, so to speak. So it's quite an exciting time. And all of a sudden, new drugs were coming up and new therapies were being developed. So 1995 was, in a sense, the right time to get colon cancer because things were happening. And our association began at that time and was incorporated formally in 1998. And like most of our organizations, we're dedicated to three things: to awareness and education. So the sensitizing the population, getting them to hear and know what colon cancer is, getting off the taboo of talking about it. And we do education for the public. We work on guidelines with physicians. We do, of course, support for patients in various ways. Thankfully, virtually today, we can reach more people. And advocacy, lots of advocacy. And one of the key things that we were able to achieve is population-based screening in all the provinces and territories in Canada, with the exception of one, and that's coming soon. We work in health technology assessment. So we work with government in order to inform the payers why they should reimburse medications in Canada and in an equitable and timely manner. You know, precision medicines have made a huge difference for all of us and all of our patients. And that really changed the way we're doing things. First of all, we had to start thinking about encouraging the population, the patients and physicians, to think about molecular profiling, upfront reflex testing, so that the right people would get the right treatments at the right time. And that's extremely important. And then what are the patient's values and preferences, and what type of drugs do they want? And this had a big impact on what we do in health technology assessment. So we are engaged in research ourselves in this area globally. And, you know, just to talk about two other things. One is the necessity for patients to learn and participate in clinical trials, to engage in research and the importance of it, not only for their own treatment, but for others. And we've been very focused around patient-centered approach to clinical trials, and working on decentralized trials now and encouraging that to happen so that more people can access trials. And just two other little points. One, of course, in the United States really brought this to attention, I think, together with our combined efforts in Australia and the UK and the US, and our Never Too Young and across Europe, our early age onset programs, and how we're seeing now people in the 20s to 39s being the fastest growing group of colorectal cancer patients. I was 40, just turning 41 at the time, but now we're seeing 20-year-olds and with advanced aggressive cancers. And fortunately, some are benefiting from immunotherapies, which of course we didn't have at the time. And then COVID made a big change, and I'll just conclude with that. And we're working in healthcare resiliency. So many of our programs are not just gauged to colon cancer, they're really broader. We're thinking about cancer in general, because I personally believe we won't be treating colon cancer in a number of years. We'll be treating the mutations, the pathways, and so forth. So while we'll treat now by disease site, we'll start thinking more broader. And in healthcare resiliency, the importance is really access to data. And this is I'll just conclude with that. This is the whole area that we're working on. And I'll leave it with that.
Barry, amazing work, amazing career. Next up, we have Zorana from Digestive Cancers Europe. Zorana, what brought you into the colorectal cancer space, and what is your organization doing?
Thank you, Andy. And it's a great privilege to be here with all of you gentlemen today. I think that I can say that because I know you now for a number of years. Whenever we met in the past, I really learned a lot from all of you because you have been longer in this field. How I started. Well, I finished molecular biology, and I had this great idea that in the lab, I will be able to find the cure for cancer. Then my mother was diagnosed with cancer. It was not a colorectal cancer, but it was a kidney cancer. And I talked to my professors and I said, there is this mutation, this treatment, what do you think? And he told me, please don't be naive. What is happening now in the lab will be with patients in the next 10 or 15 years. So I said, okay, I cannot wait 10 or 15 years. What can I do next? And this is how I went to the pharmaceutical industry, and I have been working in sales and marketing of drugs used in colorectal cancer. I had the chance to launch the first biologic drugs. But then I realized, because I come from Serbia, that not all patients are able to receive those biologic drugs. They can make a difference. And I wanted to do more. And I first joined the local patient organization, volunteered with them for a while. And this is how I met Yola, the lady, the founder of Europa Colon, who started the organization in 2004. And 10 years ago, I joined Europa Colon. I was doing the work with our member organization, because we are an umbrella organization of currently 35 national member organizations across the world. And I started enjoying this work with them, learning from them, because I think what is different for Digestive Cancers Europe to the other organizations that are here today is that we have those different, I don't know how many countries across Europe that we represent, and they all have different problems, and some have screening, some don't have screening, some have good screening, some would improve, or change the age, the age for screening. Also, when it comes to treatment, so we see the huge variations, obviously, in overall survival. And also the mentality of people is different. So we work closely with our member organizations, and similar to other organizations, we develop awareness campaigns or educational materials, but we also have to take into account all these different European countries. So very often my communication team, they come up with a very catchy title for awareness campaign, and then we go back to our member organizations and they say, sorry, this cannot be translated. So this is something that makes our life difficult, but I would say that we do similar to all other organizations. We do awareness campaigns, we do advocacy work, we are very active at the European level, and I think it's now is really the time when we can make the difference for screening and make the screening available across all of the Europe, because last year the European Commission brought the Grand Beating Cancer Plan. So there is a lot going on there. We produce educational materials for patients. Again, this needs to be translated into many languages, and also we participate in a lot of research projects, work with European medicines agencies. So I think this is similar to all of our organizations.
Yeah, you sound very busy, but doing great work. Julian, tell us what brought you into the colorectal cancer space, and tell us some of the great things your organization is doing in Australia.
Thanks, Andy. Well, it was just by chance in many respects. It wasn't a career choice. It wasn't a career path. It wasn't a direct impact at that time, not known. So it was a small hospital-based foundation is where the entity started out in 2000 by a patient who passed and bequeathed quite a sum of money to have it set up. And it was primarily run by health professionals and gastroenterologists and surgeons to do something that, to have an impact and make a difference. And so they were coming around at that time to looking to take it beyond just a hospital type foundation and take it broader. So I joined the organization at that point back in 2005. And then the path for growth was really set from there. But upon joining, I guess, the organization, that's when sort of like family history catches up with you, because no one speaks about colorectal or bowel cancer, as we call it here in Australia. And then lo and behold, the entire family history suddenly became quite clear from a number of different people in the family. In particular, young onset bowel cancer was very much in the family at that point, first and second degree relatives equally. So yes, that then of course has put me on another trajectory of surveillance colonoscopies, for one of those wonderful things that we have to go through. But nonetheless, it was just by chance that all that sort of married up at that point in time. But from there, the organisation was actually going backwards. It was hemorrhaging funds at the time. So it was a real challenge, one, not only from an organisational point of view, but two, as you alluded to previously, it was about putting bowel cancer on the map. It still is the second deadliest cancer in this country. It was back then, and it's still going to be, if projections are correct by Globocam, for example, by 2030. So it's not really shifting in terms of the impact. We have an aging population, as we know. That's primarily a driver of it. But as Barry alluded to previously, and we've certainly got the Rise in Young Onset and the Never Too Young campaigns we're doing globally. I think they're a great initiative. And we've got some great movement out of the US in dropping the screening rate down to 45. We're actually pushing further to drop it to 40 in this country and expanding 75 to 84 as well. So we do have a national screening program that was implemented and launched back in 2006. It was a very slow phased program. It was basically two ages, 50, 55 and 65 at the time. Then they added 50s and they kept expanding. However, the actual timeframe for implementation was going to be 2034 by the time it was fully implemented for people like 50 to 74, until we got wind of that. And it was then brought forward to 2020, thank goodness. But it's an at-home test. And as most people know, you can do it at home, but very much, that's one aspect of screening. People, if they want to do that test at home, we currently have a participation rate about 41%. So it's not a huge take up of that. But then we've got people who access colonoscopy equally. So I'm very much, whatever your choice is, as long as you're doing some form of screening, that is all we can hope for in that respect. So the organisation has grown since then. In 2011, we actually engaged with our peer-to-peer support network. We engaged telehealth nurses and nutritionists, all based on sort of government research that was providing support and what really the needs of bowel cancer patients were and weren't currently being delivered. So we took up the mantle on that front. So we've been providing telehealth support, which seems to be a new buzzword since the advent of COVID. But nonetheless, we've been doing that since 2011. So we've come up to our 10-year anniversary of providing those types of services already. So alluding again to what Barry was saying, the impact of COVID for us, it really didn't have a great impact from a service point of view, because we're all fairly well equipped for that. And most of our platforms are all through Salesforce anyhow in that sort of front. So remote working and remote service providing to patients was fairly seamless outside of an office environment. Since then, we've got a chair in bowel cancer research, which we co-funded with the University of Sydney. That was a $10.4 million project over that period of time. So that was actually named after a long-term survivor, bowel cancer, and our patron's father, who sadly passed away at the age of 97 last year, I think actually 98. So that was a success in terms of the research. As I said, we've got our nurses, nutritionists. One of the challenges I think we faced early on, we can raise awareness, but what is the call to action once you start raising the awareness? What do you want people to do? You can look for symptoms. That's not an obvious one. And then you see a GP, and hopefully, if you're not young necessarily, because there are challenges and barriers if you are young, having that colonoscopy and being referred for one. But ideally, that's one aspect. But the biggest one for me is if you're raising awareness about screening and the government program didn't exist, well, let's create one. So we did. We teamed up with the Pharmacy Guild nationally. We had a distribution network by them. We teamed up with a local manufacturer who actually export more of the fit tests to the US, I think, than what they actually sell here. And Bowel Screen Australia was actually born back in 2010. And so successful as a program, we actually then exported it to New Zealand, and it still survives to this day. It was never meant to be a long-term program. The government program was designed to be there within a 10-year span. But as it turns out, bowel screen is still very much relevant to those now under 50 and those over 74 who are not eligible for the government screening program. So that's one of the sort of meaningful, impactful things that we could do that helps not only prevent, but detect the cancer early. And likewise, we then invested in the patient-reported outcomes and worked with ICHOM. So we really want to continue to put the patient voice forward in treatment and care. And so that is continually heard and not so much dismissed throughout the process. So yeah, it's been an enjoyable period. A lot's been achieved.
That's quite a career that you've had. What kind of advice would you give somebody else who's touched by colorectal cancer, who says, you know what, there's no colorectal cancer organization in my country or in my town or my city?
Well, I guess from our perspective and looking back on that time, there was no voice. So that's the great starting point. It was a small hospital-based organization. It was yet to have a voice. It was yet to give a voice, more importantly, to people impacted by bowel cancer. So to me, it was fulfilling that unmet need. And that's what really, to me, drives the core. If there's an unmet need that is not currently being filled, then it's time that someone get off their butt, no pun intended, to go and do something about it. And again, that's pretty much the motto that we've followed all the way through. Don't be afraid to lead, because leading will get you somewhere. Following tends not to. The followers will follow you in time to come. They'll argue with you to start with and try and probably put you out of business, but nonetheless, that's a story for another day. But in terms of that, it's also being clear, I think, about what you want to achieve and how you're going to achieve that. And I also look at it, fact is, it's got to be meaningful and impactful as well. There has to be some measurements that we can actually take back to say achievements and goals are being met. Otherwise, we're not doing our job to either have drugs listed, for example, so patients can benefit, or have a screening program implemented. Our current barriers, for example, are access to colonoscopy. It's one thing to do a screening test at home, but if you're waiting 9 months for your colonoscopy, not knowing if your positive result is cancer or not, well, that's not a good outcome. And all of a sudden, we find that the shifting guidelines change, whereas colonoscopy is recommended within 30 days, for example, from a positive test, which then suddenly blows out to 4 months, which then the creep continues. So that's where we look at the unmet need, the bottlenecks within the continuum of care entirely, and picking out those aspects where we can really make the most difference, make the most noise. And I'll take just the colonoscopy example again. For example, we actually got it listed on the Council of Australian Government for Health Ministers. They actually had it as an agenda item now, and funds started flowing to deal with the wait lists. There was, I think, 12 million committed into Victoria. There was 5 million in South Australia, another 5 million in Tasmania. And federally, there was around about 35 million committed as part of the budget process to follow up people who had a positive test to ensure that they then went and had their colonoscopy. So again, we don't look at being a big organisation. I'm not a believer of being big necessarily, but we can certainly impact change and certainly have a big impact in that respect. But it's thinking strategically and smart and then making it happen.
And Barry, you've been leading the colorectal cancer movement in Canada since the 90s, and you started it. You were a person who was affected by cancer, and you said, I'm going to not accept that nobody is fighting for the colorectal cancer patient in Canada. And we know how far you've come. So what advice would you give someone who's just starting out, like you, today in a country that doesn't have an organization like yours?
It's an interesting thing. I've been listening to so many parallels with everybody, who's speaking today, but in particular with Julian, because of the healthcare systems are aligned. So healthcare systems vary from country to country, and so those issues and the ways to approach them tend to be similar, not exactly the same, but similar. I would say the first lesson that I learned was not as a patient, but as a lawyer. And that was from a senior litigator when I started my career, who said to me, Barry, if you do nothing, nothing happens. And so, the reverse, of course, is do something stupid, just don't sit there. And that's what happened. It wasn't born because I was so thoughtful about it. It was born out of necessity in my particular case, because without accessing care in the way that I did, and I didn't know this at the time, of course, I wouldn't be here today to speak about it. But I would say the first thing is passion, right? The need to move, the need to do something is usually the impetus for all of us, whether it's a family member or whatever the situation is, yourself. And the second thing is the move to action. So identifying that unmet need, as Julian really put forth correctly, and then going after what you can do to affect change. And that will vary from country to country, from organization to organization. I mean, to the very particular amazing things that I was astounded, that Bowel Cancer Australia and Julian did to get ICHOM to do guidelines for colorectal cancer. I mean, it's outstanding. That's ground setting for all of us around the world. What I worry about is the next generation. So with many of our organizations, they started with somebody personally touched with the disease. But when it becomes more administrative, not so personal in sort of the next level, that's the real challenge. And smaller organizations, we all go through, and all of us have gone through this, where you start from a volunteer board and decide to professionalize. That is probably the hardest thing to do. Take people's money and actually pay a person to do something as opposed to putting it into something very specific in research or whatever. And that is the only way to grow an organization and to accomplish more. But this is probably for smaller organizations the biggest challenge, going from a volunteer to a professional organization. And all of us have felt that pain at some point in our careers.
Great points, Barry. Michael, you have a unique situation because you're now running, arguably the largest colorectal cancer patient organization on the planet, but you also know what it's like to be a one person starting a new organization, because you started Chris for Life in honor of your mom. And you did a phenomenal job as a person who started this, whose life was touched by colorectal cancer. You had the passion, you had the love for your mom, that you were going to do this in her memory. And you were also not happy with the climate of colorectal cancer in the US. So that's what got you involved. And what advice would you give somebody else in your position that's just starting out?
To not start an organization. No, I'm kidding. The reason why I say that too, Andy, is like, you know how fractured our space has been, right? And it's like we're finally, I think, getting past that a little bit. But no, quite simply, I got into this because I didn't like to see my mom in pain, period. And I thought, well, wow, this happens to a lot of people. And it was never on my radar, right? Just the fact that it's really, it's just horrible. It's one of the worst things that can happen to you and your family, right? And I was like, for some reason, I thought I could make a difference. I have no idea why I thought that. There's no reason why I would have been able to, but we did. We really, really did. And so, quite simply, why I did it was because of my mom. I would also say that it's really good to see wins. And I will tell you, I don't know if you guys have read the most recent ACS information that came out, but we actually have made some successes. So African-American mortality is down 5%. The increase in young onset is now down to 1.5% a year, which is like amazing, right? Like we actually have now reversed that trend, at least somewhat. So, I mean, I would say one is I surrounded myself with people that knew way more than me, number one. Number two, I was hyper focused on fundraising, and I still am. We'll hit about 20 million this year from an annual budget perspective. So I'm hyper focused on that. And yes, from a strategic standpoint, really understanding, where can we make a difference? How can we make a difference? How can we make a more just more and more impact? Because as we've started to grow, the expectations are, yes, psychosocial support, et cetera, is very important. But as Barry, you were alluding to, I think the most important thing we can do as an advocacy organization is figure out how we can help precision medicine for patients, period. Like, how do we move forward biomarkers? How do we move forward the fact that we can extend patients' lives? We absolutely all can. If we can get the majority of patients the information that they need about their biomarkers, if we can get them on clinical trials, et cetera, it will totally change the amount of money it takes to get a new drug to market. It will obviously extend patients' lives, et cetera. So, we did the State of the Science Summit last year and really outlined across the world what research is being done, what has been done, et cetera. So to say that, Andy, this has been an easy endeavor, I would be totally lying. It is a crap ton of work. And I love every minute of it.
As you should, because when you think about the benefits psychologically and just from a happiness perspective of actually seeing meaningful change to mankind. And that is what's so attractive about the colorectal cancer space, isn't it? Because you actually can make a difference. You actually can see the successes making a difference. And you actually, and from the screening rates to the number of drugs that are now on the market compared to when we all got involved, to the decrease in mortality, to all of these great data that almost no other major cancer can claim these kind of successes in such a short period of time. So it is an amazing feeling to see an opportunity that has to be filled. There's almost a need that you must fill this opportunity that you've identified. And then to be able to actually do it is really fulfilling. So
yeah, Andy, I would just say we've not made anywhere near enough progress, right? I thank you. I appreciate it. But like, we've got so much further to go. You know, when we were doing the State of the Science Summit last year, looking at the amount of federal funding for colorectal cancer from 2006 to 2018 in the United States, it did not change, period, zero increase. Breast cancer, prostate cancers, and others got a 33% increase. And so, you know, yes, we made an advancement in immunotherapy, but if you look at blood cancers, et cetera, leukemia and lymphoma had something like 22 new FDA approvals last year. We had 2. So anyway, we just still got a lot of ways to go.
We are the left behind child for sure in every respect and always have been, but still the metrics of success are tremendous. And you are right. And if you think that you have a long way to go in the United States, you can imagine what's happening elsewhere, which is really why we created this organization and why all of you today are helping those startups that are in countries that have zero colorectal cancer screening programs, that have zero access to medicines. Zerona's members, she knows in some of her own countries, they have no access to some of the medicines that right across that border you have full access to. So yes, a long way to go all across the planet. And Zerona, from the last statistics I read, I could be wrong, but I believe Europe has 1/3 of the population of colorectal cancer cases in the world, yet only 10% of the world's population. It's been an epidemic in Europe for many, many years. And I know that you're dealing with a whole range of issues from countries that are, you know, far advanced, that have fully covered colorectal cancer screenings, colonoscopies available to all, to, you know, countries that you cannot possibly get screening. Tell us what advice you would give to somebody starting out, say in a lower or middle income country. What advice would you give them?
Yes, thank you, Andy. And you are right about the figures that you just mentioned. And also, we know that, for example, problem with screening, even if we look at EU only, that is usually the higher income countries, there is screening not available even in those countries. And if we look at EU overall, only 14% of citizens had the access to screening. That was the latest report that was published in 2018, so just before COVID. So it's really difficult, but our advice would be, and this is what we are trying to promote, to learn from each other, because, you know, there are countries like Slovenia, like the Netherlands or the Basque region in Spain. They have the participation rates of 65, 70%. And, you know, we are trying to be that platform and to provide the exchange of experience and, you know, to put together the countries that do the job well, for example, for screening, and those that don't have the screening, and to help them set up the screening programs. And when it comes to low income countries, and, you know, I think it's really difficult to set up the organization there, because what we see is usually there is somebody, a family member or a patient that is affected by colorectal cancer, and they realize that there is so much more to be done for other people. And fundraising is extremely difficult for them, because the governments don't help in those countries. There are no funds available, and also it's really even difficult to fundraise with industry. But, I don't want to say that there is no hope. I think the hope is in joining bigger networks like ours, in having a dedicated team, like 3 or 4 people, because from our experience, an organization usually that starts with one patient or one family member without a plan that does not succeed. So it's finding 2 or 3 people that are really motivated, understanding the situation very well, what are the issues, and what are the gaps that they can cover, and then coming up with a simple plan for the first couple of years and setting up the goals that could be reached. Because from our experience, it is very unmotivational to have, a very high goal that you cannot reach in the next, 5, 6, 7 years. So come up with simple steps and small gains to get to other stakeholders, so they can get to know you, recognize you as an important player, and then grow steadily.
That's really good advice. And it sort of leads into the next area of discussion, which is, how do you get there? How you need to have money in order to execute programs. So how do you get there? These new organizations are struggling, especially with the pandemic. I've heard from them personally that government funding has dried up, and that was their source of revenue. And what we're wondering is, and we'll go around to each of you, what advice would you give someone that's having, these great ideas that we need to put a colorectal cancer call to action in our community, or we need our government to put in a colorectal cancer screening program, or we need access to biomarker testing? That's the key to the future. It's the key to understanding your cancer, and it's the key to getting you on the right treatment that could potentially cure your cancer or give you a much longer, better life. So we have these great ideas, but we know we need money, and we need partnerships, and we need industry, and we need all of the stakeholders who are involved in the colorectal cancer space to get together and to be part of the team. So how do you start that? How do you raise the money? Let me go to Julian first, because you had a pretty unique situation with this starting out from a gift from somebody's involvement in colon cancer, or either their death, they left you money, or they gave money while they were alive. And with that started some organization that has now grown into Bowel Cancer Australia. What advice would you give someone on how to develop those partnerships and those stakeholders and raise money?
Yeah, I guess, Andy, it started, yes, as you said, it was a bequeath. The patient had passed and that left a lasting legacy, wanting it to really have an impact and have a long-term. So I would say from our perspective, it was, it started out with events. That's what people did. Like-minded people came together and they held events and raised funds. That was, the root cause of fundraising 101, effectively. And you chip in a bit here, a bit there, and you start growing that way. And as the organization started to grow, then the events either got bigger or you did more of them, you did them in other locations, and the network keeps growing exponentially like that. Then we took a strategic review of the entire organization at that point, and we got serious, and a business case was developed. And then we went into more of a commercial fundraising aspect, which then provided a core sustainable funding model that enabled you to grow. It doesn't happen overnight. It takes quite a number of years to get off the ground. But nonetheless, you've got to start somewhere. And as I said, initially the organization was going backwards. It was actually dipping into the funds to survive, but ebbs and flows in that respect. But we got some sound advice. We got some great people on, and Michael alluded to that before. You've really got to surround the organization and yourself with great people, and people who are equally as passionate. And so many people are so willing to give their time also so freely. And I think that is really a testament to the passion that really is around the organizations and what they mean and what they can do then for people as well. So you build that as it continues to grow, then we had streams that we could rely on then for funding each year, which enabled us to invest in other income avenues. And like BowelScreen, for example, then was launched. And in all honesty, that cost us some total, effectively, the organisation of $800 odd. but we had a screening program, and we had a distribution network, and we had a manufacturer, for example, and it all just came together. And yes, people had to purchase a test kit, but not everything in this world currently is free when you're a charity. But nonetheless, it has to start somewhere. So that's how we tended to grow in that respect. And then we got far more commercial orientated, got serious. And this year, for example, there are some fundraising aspects, nowhere near what Michael has achieved, though, in that respect. But in terms of bowel cancer in Australia, sort of our annual budget's around 2.5 million. It's not huge by comparison, 1/10 actually of Michael's, but nonetheless,
pretty huge.
Relative for where we are and what we do in that respect, but nonetheless, see it. So it's just being, I think, smart at it from the outset and really know where you need to invest in to get that sustainable funding. And then we apply that then to the research, because it's not then reliant on our fundraising to give. We actually raise the corpus and invest it, and then the research can be funded from the investments, for example, which means if the organization folds tomorrow, the research can continue in perpetuity.
Right.
That's the model we find. It's got to be sustainable, because if it's not sustainable, you're really setting yourself up for failure.
Amazing success stories. I just love these. So Barry, you started from scratch. You were a colorectal cancer patient starting an organization from ground zero. So how did you raise money, and what advice would you give to others on how to raise money and build these collaborations that help organizations grow?
So don't get discouraged. That's the first thing, because when we hear numbers, first of all, think about the population size of your country. Not everybody has over 300 million people in their country, and we're 1/10 of that size with about 33 million people. And not all populations have the same donor spirit, right? So, for example, in the UK, they're very generous. The population at large is very generous. And in other countries in Canada and varies across the country, there's a lot of differences as well in that regard. So fundraising events is the way we all began. Unfortunately, that's a very costly way to raise money too, because you have to invest in the people and in the infrastructure and the costs. Today online fundraising seems to be the way to go. And usually with an emotional story, you can raise some amounts of money. So a generous donor, a family member, these are the way that a lot of the fundraisers get started. But there is a strong reliance in most organizations as they grow in some countries. And again, this varies from country to country, on the pharmaceutical industry and the biotech industry to help support programs. And today that's become even more complicated. It used to be you would get an unrestricted grant to help seed an organization to grow. And now it's very programmatic. You have to show a program, you have to hit milestones, and it's kind of like an investment, which is good too, because it helps to form, an organization and achieve certain specific goals within a time frame. So, the events is an expensive way to go. Online fundraising today is probably the best thing that ever happened. But hitting the corporate world as a whole is probably the most challenging to do, because, what's in it for them in a sense, in just going to any company and saying, raise money for colon cancer, if there's no personal connection, that's very to do. Foundations are another way. Sometimes you're able to do that. Again, it varies from place to place. You have to get lucky for the right foundation, the right person. And networking, as Michael and Zorana and Julian all do, knowing different people, getting out there, meeting different people, whether it's politicians, whether it's, other people who are touched by the disease, organizations engaged in this environment. So a lot of networking to do. Don't make the mistake that running a not-for-profit is not a business. It is a business in every sense, like any other business in the world. You have your expenses, you have your revenues, and at the end of the day, if you keep losing money, you're going to be out of business. So, that's the strategy. And as Zorana rightfully pointed out, creating a strategic plan to grow is the first step. Following the strategic plan is the challenge, to affect what you've planned out to do. and to achieve the goal. So no easy answers to the question. Unfortunately, there's no magic formula. It could be that donor. It could, sometimes you get money. Like, how did this even happen? That somebody heard of us and somebody, sends you some money. And other times you're working for years in order to achieve the goal, and finally it pays off. But hard work at the end of the day. As Michael said, he was hyper focused on fundraising. I'm going to keep that in mind because I'm very, very focused. And now I guess I'm going to go with that. Having heard the good news, so where you're at, I'm going to be hyper focused as well to achieve similar goals. Keeping in mind not to set my goal too high because we are 1/10 of the population size of the U.S. So those are just some of the things. At the end of the day, I would say keep plugging away. Don't get discouraged. Hard work will pay off. And this is, I think, a fantastic lesson that we shouldn't forget. Any of us shouldn't forget. When we all started and we had nothing, we were still able to accomplish, quite a bit, right? At that time. So even through volunteerism and hard work, until you reach that stage, just through your passion and getting people organized on a volunteer basis, there's still that opportunity to bring about change.
Michael, you have had a little bit of success in fundraising. You have taken this organization and as you say, you may hit $20 million this year. That to me is a dream come true to hear that the world cares about colorectal cancer that much, that you're able to raise so much money and do so much of the great work that you're doing. But you also have the experience of starting an organization, Chris for Life, from scratch. So how did you raise money, and how do you raise money? How do you take an organization and make it a multi-million-dollar organization?
I mean, first thing I would just say is from the very beginning, I took kind of like a very public facing, consumer facing approach to it. We started with my mom's friends, literally. It was just like, we built a small, literally 100-person community, Chris for Life community in DC. And that's like literally how it started, right? It started in our basement, and we didn't do anything special. We did emails, we did printed invites, we did small events. We had we started eventually walks, but really at first it was just building a community. And I remember the first person I talked to after my mom was diagnosed was not Nancy Brinker, but Nancy Brinker's equivalent in the DC chapter of Susan G. Komen. And she said to me, she's like, Michael, if you want to have impact, you have to have money. And if you want to have money, you have to have awareness. And it's like this vicious cycle. And so I also knew that like having a community, creating social awareness, whether that was on social media or within your own community, et cetera. And you had to do it kind of at all ages. So we started a small little young professional group that kind of did their own thing, right? And then I think the real success as we continue to do it is you've got to build that community beyond DC, and do it in communities across the country. So you have more people that unfortunately are still affected by colon cancer that are rolling up their sleeves and volunteering and, raising money and doing what we call Blue Hope Bashes or our walks or other things. So I really think it's a simple formula. It starts with that small community and engagement and really cultivation and truly caring about a small group of people, and then building that beyond that. But I feel like if you create that bond, people will give.
Very helpful. Zorona, you talked a little bit about this, but what have you seen in some of your lower and middle income countries, some of the smaller organizations that maybe were started by one person or two or three people? How have they been able to raise money, and what kind of challenges are you seeing them facing?
Well, I have to say that, I believe the last 2 years have been really difficult for them. On one hand, they had more demand from patients. The patients needed the support even more because at some point the health officials or the clinicians were not able to see the patients. And this is when the patients turned to those organizations. And on the other hand, we heard from them that their funding dried out and that they had to, have the number of their staff being reduced. So it was really terrible for them. But I hope that the pandemic, on one way or the other, is behind us, and that they will now continue to grow, because they had to adapt, like we all did, in the last 2 years. In the past, they used to go to hospitals and, meet patients there. Now they're meeting patients online. But I think it's really important to stay focused, to keep your priorities, because, in some situations you cannot do everything you wish to do, but stay focused and also make the public aware, on your situation, talk about it. And then when I speak about the priorities, I think that, for me, for example, I think that I cannot say that I am hyper focused, but I am very focused on fundraising. For me, for my organization, this is among my top priorities. And I think that every single day I do something to fundraise, because I understand that, that's the only way to keep us running. And I understand that some small organizations cannot do it that way. But my advice would be, think about the fundraising being your number one priority, and dedicate some time to it. And then, dedicate some other time to do the activities that you are doing.
So again, really good advice. And unfortunately, I'm really sad to say that we're running out of time and I'm going to have to close, but I want to go around to each one of you to give one final piece of advice to that person who's thinking about starting a colorectal cancer organization. I know my piece of advice would be to dedicate a week and spend hours every day looking at each of your organization's websites. That's what I would recommend, because they're going to see all of your programs, how all of you support the colorectal cancer patient. So Barry, you've been through it all. What would your final piece of advice be to those that are just thinking about starting a colorectal cancer organization?
Sure. I would say actually the thing that I would do if I was starting an organization would be look for the unmet need. See how you can do just that one thing to make a difference, and then collaborate with as many people and organizations as you can do. Looking back, I would say that's the hardest thing. That's the thing I didn't want to do as much. But that's the collaboration is exactly, I think, the mistake I made that I learned as our organization matured. And it's colorectalcancercanada.com.
Thank you, Barry. Thank you again for your participation, and congratulations on all your great work. Julian, what would your final piece of advice be for somebody thinking about starting a bowel cancer organization?
Well, it's already probably been said. I just add to what's been said, and we're all here to help people, and that equally implies to anyone looking to start up an organization. I mean, reach out to us. You know who we are. Yep. You've heard us potentially, hopefully, and we're amenable to helping. So if you want to collaborate, as Barry said, and you've got the passion and you want to start up and you're going to meet some unmet need, drop us a line or give us a call.
Right. So your point is, look at what's out there already. Before you start your own, see if there's an organization that you can join or collaborate with, start a chapter for, get in a leadership position with, join a board, volunteer, right? There's lots of opportunities to help an organization like yours. Julian, thank you very much for your great and valuable participation. Michael, what do you say?
I say, make sure that your motives are in the right place, and make sure that this is, as Julian just said, about helping other people, either in memory of a loved one or just because you want to help your community. I think like staying focused on on that piece for me, like the fact that I still talk to patients, that I still talk to caregivers, that I still see them, that I still like, I'm heartbroken when all these things happen is a good thing. It's hard, but it's a good thing. So, you know, I am just insanely motivated to continue to do this. And I think that's, you know, if you can inspire other people as you begin your journey too, I think that that is exactly why we all do this.
Yep. Zorana, tell us what advice you want to give. First, what is that website?
digestivecancerseurope.eu is the website. And I can only repeat what my colleagues said. You know, I think it's understanding the landscape, what the problems are, think about what you can solve, reach out to various stakeholders, you know, and make sure you know them, create your alliances, reach out to bigger networks, and, you know, work together, either with some other organizations in your country or with some umbrella organizations in your country. I really think that together we are stronger. So that would be my advice.
Zorana, thank you so much for your participation. Thank you all panelists for your participation. Next year, we're going to do this in person, and you all have a great day.